What is chlorine? Chlorine is a gas with a greenish-yellow color. It has a strong, irritating odor. Chlorine is used in water purification, as a disinfectant, as a bleaching agent, and in making chloroform and other compounds. Where can chlorine be found and how is it used? In industry, chlorine is used in water treatment and chemical processes. In pulp mills, chlorine is a key part of the bleaching process. Chlorine is used to disinfect swimming pool water. In the home, forms of chlorine are found in cleaners and disinfectants. How can people be exposed to chlorine? You could be exposed to chlorine through breathing chlorine if you work or live near a site where it is used. Exposure can also occur by breathing air from treated drinking water or swimming pools. Drinking water containing chlorine. Exposure also occurs when water containing chlorine is used to prepare food. Touching chlorine gas, chlorine bleach, or water containing high levels of chlorine. Low-level exposure can also result from touching soil containing chlorine. Eye contact through exposure to chlorine at work, or from touching the eyes with water containing chlorine. How does chlorine work and how can it affect my health? Exposure to chlorine can irritate the nose, lungs, and throat. Exposure can cause the eyes to tear, coughing, mucus, bloody nose, chest pain, or shortness of breath. Breathing chlorine may permanently damage the lungs. Higher exposures can cause fluid to build up in the lungs, resulting in severe shortness of breath. This is a medical emergency. Any contact can severely irritate and burn the eyes and skin, causing permanent damage. Long-term exposure can damage teeth and cause a skin rash. How is chlorine poisoning treated? There is no treatment for chlorine poisoning. A doctor can treat the symptoms. What should I do if exposed to chlorine? If you get chlorine in your eyes, flush eyes with plenty of water for at least 30 minutes. Lift the upper and lower eyelids from time to time. Do not rub your eyes. Do not keep eyes closed. Get medical help quickly. If you touch chlorine, wash skin with plenty of soap and water for at least 15 minutes. Remove all clothing and shoes that contacted the chemical. Get medical help right away. If you swallow chlorine, do not throw up. If possible, drink 2 to 4 cupfuls of milk or water. Get medical help right away. If you breathe chlorine, move to fresh air. If breathing is difficult, give oxygen. Do not use mouth-to-mouth resuscitation. If breathing has stopped, give artificial respiration using oxygen and a device like a bag and a mask. What factors limit use or exposure to chlorine? To limit use or exposure to chlorine, you can buy products to remove or reduce chlorine in drinking water. If you use products that contain chlorine, follow all directions. If you use chlorine at work, follow all health and safety rules. Products that contain chlorine should not be mixed with other products since mixing creates dangerous gases. Is there a medical test to show whether I've been exposed to chlorine? There is no test to show chlorine exposure. However, a blood test may show damage to red blood cells, which could indicate chlorine exposure. A doctor can look for the effects of chlorine exposure by testing lung function, as well as checking the skin and teeth. Medical observation is recommended for 24 to 48 after breathing over exposure, as pulmonary edema may be delayed. Technical information and resources can be found in the video description.